The American Psychological Association, or APA, recognizes 56 different branches of the modern science of psychology. In this video, I'm going to talk about some of the major branches, and I hope to give you a little better understanding of just how big of a field of study psychology is. Before I begin, I do want to say that any branch that I leave out of this video doesn't mean that that branch isn't important, just that I don't have time to cover them in a shorter video, and I want to make a point of talking about some of the branches that are usually discussed in a general psychology course. For example, I work in psychology, and I'm a professor. However, I won't be talking about educational psychology because it isn't usually covered in a regular college course. Let's start by talking about what most people think of when they think of a psychologist: counseling psychology and clinical psychology. These are the folks that usually see patients and provide therapy. A clinical psychologist usually sees patients that are diagnosed with psychological disorders. Counseling psychologists typically see people that may not have disorders, but are just struggling with mental health problems like grief, general anxiety, or other issues. However, it's worth noting that there isn't really a clear distinction between these two branches, so you do sometimes see some overlap. The next branch is one that is lesser known, and that is health psychology. Health psychology can be seen as being the bridge between psychology and healthcare. Oftentimes, you'll see health psychologists working in hospitals or doctors' offices. They can help create a more integrated approach to health. If you think back on the biopsychosocial perspective, remember that we don't really view things as only being biological, psychological, or sociological. So if you're diagnosed with a medical condition like cancer, it's important to treat that person psychologically as well as medically. And this is where a health psychologist can come in. Neuropsychologists focus on the interaction between the mind and body. Many times you'll see neuropsychologists working in labs, but a lot of them also see patients in clinical settings. They can be very helpful in working with patients that are suffering from neurodegenerative issues like traumatic brain injuries or TBIs, Parkinson's, and many other conditions. Social psychology is another really amazing field of study and is actually one of my favorite topics to teach. Social psychologists look at the interactions between groups of people. This can mean looking at how an individual person interacts with other people and works within a group. It can also mean looking at things like romantic relationships, friendships, and even far more expansive topics. I often like to say that social psychology goes from who we date to why people hate. It's a pretty expansive topic and does indeed cover issues like racism, hatred, violence, and other heavier topics. Moving on, we come to sports and exercise psychology, which is definitely one of the lesser known branches. In fact, a lot of people are surprised to hear that many professional sports teams have psychologists on their staff or contracted with them. By the way, if any professional sports teams are looking, I am definitely interested. I just wanted to throw that out there. Sports psychologists can also work with fitness counseling and personal training. The last branch I'm going to talk about is definitely one of the better known branches, and that is forensic psychology. It's interesting because a lot of people have heard of forensic psychology, but they don't really understand what all it entails. Forensic psychology is essentially the bridge between the legal system and psychology. That means that forensic psychologists can work for the court system to help determine if defendants are fit to stand trial. They also work with lawyers to provide consulting services on things like jury selection. Many forensic psychologists work within the correctional system and the juvenile justice system. Of course, what many people know forensic psychology for is criminal profilers. Most people think of profilers that work with the FBI to develop personality profiles of serial killers. I really want to point out, though, that this is really a small slice of what forensic psychology actually is. I mean, just think about it for a second. There are thousands and thousands of forensic psychologists. We don't have tens of thousands of serial killers to keep all those folks in business, and thank God for that. As I mentioned, this isn't a full list of branches, but just a few of the better known major branches. I did want to spend some time clarifying a little confusion over terms we use for people that work in mental health, and that confusion is totally understandable. After all, we have terms like psychiatrist, psychologist, counselor, therapist, and many more. So what are these professions? Are they the same or are they different? Let's start with the difference between a psychiatrist and a psychologist. Now, both of these folks are doctors. They went through college and they got their bachelor's degree, then they went on for their doctorate. The difference is that a psychiatrist is a medical specialty, just like cardiology or neurology. That means that they go to med school, then seek out a specialization in mental health after they graduate. They usually focus more on the biological causes of mental health disorders. They are able to prescribe medications and order medical testing. They don't typically provide therapy or counseling. Psychologists are also doctors, but they are not medical doctors. They typically focus more on counseling and therapy, and many of them work in research. Most states do not allow psychologists to order medical tests or prescribe medications. However, a few do. As of the date of this video, Illinois, Idaho, New Mexico, and Louisiana all allow psychologists to prescribe medications. However, that is definitely not the norm. Most people that need mental health counseling, though, don't go to a psychiatrist or a psychologist. They typically see therapists that have master's degrees in mental health, and they have terms that can vary widely from one state to the next. Now, I live in Florida, and we generally have 3 types of mental health therapists. An LCSW is a licensed clinical social worker, so this is someone with a master's degree in social work. An LMFT is a licensed marriage and family therapist, and an LMHC is a licensed mental health counselor. Although these folks have some different titles and there are some slight differences between them in terms of their view of mental health counseling, they all can largely do the same thing. And depending on where you live in the United States, your state may have a slightly different term for these professionals, but again, they largely do the exact same thing. The most important thing to know is that if you are a person that needs help with a mental health issue, any of these people are more than able to provide you with quality therapy. Thanks for watching, everybody.